Earlier today, U.S. Surgeon General Dr. Vivek Murthy warned the weeks ahead are going to be tough as the Omicron variant continues to spread, posing a challenge for communities disproportionately impacted by the pandemic. And joining me now is Dr. Gigi El-Bayoumi, and she's a professor of medicine at George Washington University and a liaison for the White House Medical Unit. Doctor, great to have you. Thanks for making time for being here. My first question is, what do you think the #1 priority for the Biden White House should be when it comes to COVID?
Wow, that's a loaded question, but I think the important one is to really make the messaging, improve the messaging. You know, I've said that, and that's for the public, although it disproportionately impacts under-resourced communities. So this idea that people switch their minds a lot, that the government is giving mixed messages, is not true. This is what I would tell the Biden administration in terms of messaging. It is like a tornado or a tsunami where we cannot predict its course. It changes its course, you know, it's nature. Virus is nature. And to stay tuned for updates. We will bring you updates on this rapidly developing story. So I think it's about trust. It's about clarity in the information. I think sometimes there is an overthinking of how the messaging is going to be. Just speak in plain English so that everybody can understand.
And that it is a unified message and that people, right, get the same message over and over again. All right. Earlier this week, we also heard from both Vice President Kamala Harris and Senator Bernie Sanders on N95 mask availability. These are the masks that all the experts are saying are really the best ones right now. Take a listen to what they had to say.
In terms of the N95 masks, they are available. There is a stockpile of, I believe, over 700 million of those masks. So the supply is there as necessary and as needed.
If people, for whatever reason, don't want to wear an N95 mask, fine, then wear something else. But the simple fact is that a whole lot of people don't know that an N95 mask is far superior and more effective in protecting the individual and in spreading the virus than a common mask. So we've got to get that word out. We have to educate.
And so, Doctor, first of all, do you think the price point and accessibility make upgrading to a better mask somewhat unrealistic for some families? Do you think that is a barrier? And I also am curious, do you think that their tone is surprising at all in the sense that, do you think we still have to be educating people, or do you think people know N95 is what you should be wearing?
Oh, look, we still have to educate people. I'm the founding director of the Rodham Institute dedicated to health equity in DC. We distributed 560,000 masks and hand sanitizers to the poorer areas of DC, and that was several months ago, almost a year ago now. Education is the key to really defeating this virus, but availability or access versus availability are not necessarily the same thing. Remember that people have competing priorities. If you do not make it easy for people to get these masks, it'll be just one more thing on their to-do list. If you've got multi-generational households where you have to take care of people, you got to go to work, you got to fill out insurance information, we have to make this available, but also to really engage those community-based organizations that know the community best, to have them be the ones to educate and reach out. Let's not forget vaccines. You know, I've got 61 patients of mine in the last 3 weeks who came down with COVID. None of them got hospitalized except one person who declined the vaccine. So you know, we can walk and chew gum at the same time. It's this and that, right?
Right. And I know tomorrow blackdoctors.org and your Rodham Institute are hosting this State of Black Health Virtual Summit. What are your hopes for that event as it relates to the health of the Black community, and what challenges is the Black community facing in particular in this pandemic? We know that they're disproportionately that community is disproportionately at risk for a worse outcome. To talk us through that.
Sure. Well, of course, it is MLK's birthday, and if we remember what the Dr. Reverend Martin Luther King Jr. said, of all the forms of inequity, health inequity is really the worst. It's the cruelest, right? So I actually pitched the idea to our partner, BDO, which has 20 million domestic followers, 200 million International, and we're part of the Black Coalition Against COVID. And I said, you know what, of course, COVID is disproportionately impacting not just the Black community, but every other historically underserved community. But people, first of all, are sick of COVID. And as a general internist, I can tell you breast cancer, colon cancer, other diseases are not going away. And actually, the mental health toll is really disproportionately impacting communities of color. Did you know that among teens and youth, suicides have skyrocketed among Black and brown kids? So we have to, of course, tackle COVID. That's the most immediate killer. However, we have to remind people about all those other illnesses that prior to COVID and sadly after COVID will still disproportionately impact communities of color, specifically the African American community, but really all communities that are under-resourced.
Right, about getting all those screenings done and making sure your mental health is strong. Good luck tomorrow, Dr. Gigi El-Bayoumi. Thanks so much for being with us. We appreciate it.
Thank you.